Challenges staying consistent in your treatment. My name is Jonathan James with Hope Charities, and it is a real joy to come to you today to talk a little bit about an upcoming patient education conference we're doing live online with some amazing content to center around this idea of how do we stay consistent with our treatment in order to have positive long-term outcomes. One of the challenges with living with any kind of rare disease, but especially a bleeding disorder, is that you have to be consistent over a long period of time to have the outcomes that you want to prevent things like joint disease and joint damage that could cause further problems down the road. And so one of the things that we wanted to talk about and highlight is, how do you stay consistent? How do you continue the progress with those days that you just don't want to get up and take your infusions? You don't want to stick a needle in your arm. You don't want to do the thing. Look, it happens to the best of us. It happens to me. And I want to take some time to really get together and talk about how we can choose some life hacks to stay consistent when life gets in the way. We're going to be talking about a lot of different things. We have some great sessions lined up for this event. It's going to be on May 22nd and 23rd. I'm really excited. We have some amazing speakers coming to talk about all kinds of different things like iron deficiency and how to understand maybe some other areas that need to be a metric for your success for therapy. We're talking about prophylaxis with a zero bleeds goal. I love that talk Dr. Claudio Sandoval will be giving. It's going to be an amazing time to ask questions and really get to, how do we get to zero bleeds? We talk about ABR a lot of times and we're satisfied with 1 or 2, but how do we get to 0? That's so important. And then we're going to be having some patient discussion panels. I'm really excited about those 2 different ones, one for men, one for women. We're going to be talking about the different approaches of long-term success and why it's so important to stay on track and how to stay on track, which is really important. And if you're a woman living with a bleeding disorder that you've had difficulty getting treatment, maybe you've gotten a diagnosis, but you haven't been able to get prophylactic treatment regimen prescribed quite yet, we're going to be talking about exactly some examples of stories of people who've been able to really advocate for themselves to get on that preventative therapy, which is really, 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 really critical. And I'm excited to talk about that. We've got some other things talking about how to stay motivated and the psychosocial elements of that. And so anyway, lots of great content, amazing speakers from all over the country that are going to be presenting, talking about this. It's in a live format. You've got to go online and register. You can do that on our website at hope-charities.org. You can register right there on the homepage. You can learn more about the event. We'll send you all the links for all the sessions. But one of the sessions that we're going to be having that I'm really excited about is on pharmacokinetics. You might have heard of a PK study, which talks about how your body metabolizes information and the medication that you're taking. And I'm really excited about this because it's been an important key for my journey in learning how to stay at optimal health. And so I've invited a friend of mine today, Marjorie Hunt, to join me, who's going to be talking a little bit about this session. And Marjorie, it is great to see you. Thanks so much for joining me for this pre-event podcast today.
Yeah, thanks. Thanks for having me. It's good to be here.
I'm really excited about this session that you're going to be doing. And I know that there's so much for us to sort of unpack and dive into with this particular talk, but take a few minutes. Maybe this is the first time people are getting to know you. Maybe take a few minutes to tell us a little bit about where you're from and what you do with Octapharma.
Yeah. So I am a pharmacist, and at Octapharma, I'm a medical science liaison. So I'm part of our medical affairs team. And I live in Kansas City, from Kansas City, born and raised. So proud to be a Chiefs fan, and hopefully doesn't upset anybody too much.
Again,
yeah, I don't
right?
want to any debate.
Don't jinx it.
Frustrations, yeah. But yeah, so just a little bit about myself.
That's awesome. Well, you're a Midwest girl, so I know you got the gusto to give it to us and do it with a smile on your face and sweet and kind. So I'm really always done such a great job of helping in the data and how it relates to the. So you're doing right.
I am, yeah. So I am. My session is on pharmacokinetics, and I guess ultimately my goal is to try to kind of break it down into a way that makes sense to everyone, maybe a little bit easier to understand. Pharmacokinetics can maybe sound a little scary, a little intimidating or confusing. And I mean, I know that when I go to my, tax lady or my mechanic, I don't know half of what they're saying. And so when they can speak to me in a way that I understand, it helps me. So I guess that's kind of my intent with this presentation, is to try to make it um, easily, more easily understandable. And I know a lot of folks are familiar with PK studies. So hopefully, whether it's bringing it to a level that is easy to understand or kind of just diving in a little bit deeper also to make it relevant to, why do your PK numbers matter? How is it going to help you? Things of that nature.
That's so good. I think PK studies have kind of gone by the wayside in some ways because of the lack of hospitalization. It used to be one of those things you just had to do when you were in the hospital. But I do find that this is still an important metric for, I even love the title about optimizing dosing and about you and your goals. I encourage people to do this comes throughout the year about how it's important to have what you want your peaks and your troughs to be. A lot of times we don't talk about that, but I do think for a patient, one of the things where I've found a lot of success for myself has been really where I want my trough to land. I think sometimes we think, oh, well, mild hemophilia is okay. But if you have existing joint damage, maybe it's not okay. Maybe you need to keep that trough a little higher on a regular basis. And I think that that this conversation is really, really important for people to really understand what pharmacokinetics is, how it could impact, and also how to develop some goals for themselves personally, right?
Yeah, I mean, I think ultimately every person's a little different. What a level works for you may not be a level that works for me versus, the person sitting next to me. So just making it individualized and trying to optimize that therapy for each individual person.
Yeah, that's so good. I do think a lot of times we end up pushing in the clinical setting, we push everybody to sort of these like generalized norms. And then you think about with rare disease, we hear a lot of people in rare disease that don't feel like my doctor is really aware of what my personal there's so much personalization that needs to go into, and we've made all these different specialties of treatments specialized, but it's important that we keep them there by really making certain that we encourage people to say, no, it's important, like me versus my daughter versus somebody else that has maybe the same diagnosis but really needs to be approached differently. And this is one of those things. If understanding what pharmacokinetics can do for you really does help, I think provide some data that gives even your own physicians a better platform for making long-term decisions for you, right?
Yeah, yeah, that's kind of what we're hoping for
Well, that's
with this talk.
awesome. That's awesome. Well, tell us a little bit about, I know you're excited about this event. Your session specifically is coming up on Wednesday, May 22nd at 10:15 a.m. Central Standard Time. But tell us a little bit, how can people learn about your session and attend this session?
Yeah, they can go to the Hope Charities website. The website is www.hope-charities.org and register right on there.
Awesome. Great. Well, I'm looking so forward to this session. I think it's going to be fantastic. And Marjorie, as always, thank you so much for all that you do for our community. And we look forward to seeing you very soon. Thanks so much for being
Yeah,
with me today.
thanks for having me.
All right, awesome. Man, big thank you to Octapharma as well for their support of educational opportunities like this. We could not do what we do without their help and their support. It has been just a real joy to partner with them to help bring you this type of education. But one of the things I'm super excited, case studies are super the progress of your journey long term. And if you don't know about this, is definitely one of these sessions you definitely want to attend so you can understand more about pharmacokinetics. As Marjorie mentioned, it's going to be on Wednesday, May 22nd. All you have to do is go to the website and register for this. We'll send you all the links and the information. One, registration gets you access to everything, so make certain that you avail yourself to that and go to that website right now and register immediately. You'll be able to hear Marjorie's session, and if you can join for others, that would be amazing. But even just one session would be probably something that you would be able to learn from and be able to and get a lot of more information out of to help your lifelong journey with living with a bleeding disorder. We're going to have a lot of fun together too. We love generosity, and so I love giving. It's one of my favorite things to do, and so we're going to be having a lot of fun together. We're giving away gift cards and prizes and $25 gift cards, $50 gifts, $75 gifts. It's going to be so much fun. So make certain that you register and that you attend and get involved, because it's going to be a great time to be able to hang out and get to know people from all over the country, as well as have some fun with some raffles and prizes and giveaways. But you got to participate to win. So make certain that you get involved and go register right now on the website. So once again, big thank you to Octapharma for helping us to be able to put on amazing content like this to bring you the right education for improving your health health outcomes long term. And we certainly hope that you come and hang out with us. But it's been great to see you today. Thanks so much for taking a few minutes to join me for this pre-event podcast, and we'll see you